wrist pain, hand pain, forearm pain. What are we going to do about this? Hello, I'm Adam White, licensed acupuncturist. Today, let's talk about wrist injury recovery, whether it's acute trauma, repetitive motion disorder, everything from injury into the fibrocartilage complex of the wrist and forearm to carpal tunnel syndrome. What can we do about it? Where's the research? Where's the demonstrative results? What's the process, not to get from point A to point B, but from point A to Z? In other words, recovered, maybe you can knit again, maybe you can play the violin or guitar again, maybe you like to go and play softball, whatever it is that you like to do. You're handy in the kitchen with pots and pans, without pain and without mobility restriction. Let's talk about the research a little bit. Let's get right into it. Now, at healthcmi.com, you can go there, click on news, and you'll see many articles, for example, showing hard research in the news department at healthcmi.com on how acupuncture demonstratively can improve or completely recover conditions resulting in carpal tunnel syndrome. But let's also talk about triangular fibrocartilage complex. This is another injury. And what happens is where the forearm meets the wrist, there can be a lot of problems. And I would not like this problem myself because, for example, when doing yoga, that'd be very difficult to flex the forearm and wrist together. So a lot of those poses, even downward dog, even cobra, all kinds of plank poses would be very difficult with the wrist if the TFCC has a problem. And you can see an image. If you go to healthcmi.com, click on news, there's an article published entitled Acupuncture Promotes Wrist Injury Recovery Confirmed. It's research, published July 18, 2022. And there you'll see a picture of the TFCC. It's basically the side of the hand. So think of your fifth finger, your little finger, where on that side, on the ulnar side, where the hand meets the forearm. It shows a lot of the ligaments and tendons, even a disc inside that area that can be affected. And when affected, really can make all of the things we've already been talking about very difficult. The good news is that local acupuncture to these areas has been proven effective for reversing tears to this area and injury to the area. And that article specifically shows the exact acupuncture points used to create that repair. Heart 5, Heart 3, Heart 7, Small Intestine 5, Triple Burner 4, Small Intestine 6, Large Intestine 5, Bladder 62, and Bladder 63. It's all laid out there so acupuncturists can enjoy the research, see how many treatments and how long it will take to get that done for the patient. So patients can expect recovery. So if they have a history of significant wrist trauma, they have prolonged or progressive wrist pain, instability and pain of the joints of the wrist, restricted wrist movement, popping sounds from the wrist, restricted movement of the forearm, and reduced grip strength, this might indicate injury of that area of the TFCC. This can also be shown on MRI imaging. And what we know from the research published in that article that I'm referring to, again, entitled Acupuncture Promotes Wrist Injury Recovery Confirmed, is that the research shows specifically that mobility is restored and that pain is reduced. We know that those micro tears can heal. So this is specifically for moderate cases in this one. So mild and moderate cases. Again, if something happens like a major tendon snaps off, we could be looking at a surgical repair situation, right? But we're talking about lots of tearing, wear and tear, beating down on time, or an acute injury where the area has been beat up from that injury. A lot of the times, a little bit of acupuncture and some physical therapy together can get the job done and get you back to enjoying cooking in the kitchen, playing music, what have you. Even driving a car can be difficult when that area of the wrist is affected. So it's not just carpal tunnel. Now, carpal tunnel, injuries to the median nerve, that's the specialty of the house for acupuncturists. And the key point for that is pericardium 7, Da Ling. And again, if you go to healthcmi.com and click on news, you can see all the research on that. Time and time again, the research, and there's a lot of research on this, shows it's Da Ling, PC7 over and over again. It's the key point. So if an acupuncturist is treating carpal tunnel syndrome, invariably, to get the optimal results, they will always needle that point. Sometimes they'll add triple burner 5, heart 7, pericardium 6, for example. Those are great support points. Maybe large intestine 5, lung 9, things like that. But pericardium 7 is the main carpal tunnel point. And people can expect an incredible recovery. Now, if they've had carpal tunnel surgery, which may introduce some scar tissue, and then they get acupuncture, that may not produce the results that people are looking for. Then we don't know. But if there has not been surgery to the area, then we usually get the job done, and done quickly. So in the worst case scenarios, super concentrated treatment for carpal tunnel 3 to 4 times a week for several weeks to a few months, and it should be complete recovery. And in the best case scenario, it's just a handful of treatments within a month, and it should be under control or completed. So it does range, depending on how much injury. There are some complications that slow the recovery of the TFCC and things like carpal tunnel syndrome. And the main one would be diabetes. So people with this condition heal very slowly. So those can take longer, and that could be a more drawn out treatment program. So again, expectations have to be lowered a little bit with diabetes just because it does slow healing. We can get the job done, but it will take significantly longer. What's nice about Da Ling, that point we spoke about before, and a lot of these local points, is they do induce a deep relaxation, a nice effect of that treatment. A lot of the points used in the treatment of insomnia within traditional Chinese medicine, acupuncture, are right there at the wrist. So the treatment of insomnia is something that usually involves PC7, PC6, heart 7, even heart 5, a lot of these points. So again, when treating the TFCC or carpal tunnel, one can expect kind of a relaxing treatment and better sleep in general. So that's a nice built-in addition to this. So again, acupuncture for the treatment of wrist pain and mobility issues is confirmed by research. And if it was just one piece of research, that wouldn't mean very much. But if you go to the HealthCMI newsroom and take a look, you'll see there really isn't a shortage of research on this particular topic. Major universities within the United States, Canada, Australia, of course, China and Taiwan and Korea and Japan and more. This research is very solid. Why? In many ways, the forte of acupuncture is the treatment of pain in the public perception because the results can be so quick and it's very marked and pronounced. Also, I will say with the median nerve, it really loves a little bit of acupuncture. It just tends to heal very nicely. This particular peripheral nerve involved in carpal tunnel syndrome, for example, does very well. So it's located above the carpal tunnel sheath where the forearm meets the hand on the medial aspect. And a simple stimulation of that region tends to enhance blood flow, micro blood flow to that particular nerve fiber, and then it heals. And as it heals, the carpal tunnel resolves. It brings inflammation down at the same time. It has a very powerful anti-inflammatory effect. And what you'll see in the research is that pro-inflammatory factors decrease. These factors are things like TNF-alpha and IL-6. Over and over again in the research, you'll see acupuncture can bring down the inflammation, and the objective quantifiable measurements show reductions in pro-inflammatory cytokines. So the results are subjective and objective in global research. So that's very good news. I think something about wrist pain is that a lot of people don't have all the tools necessary to recover. The first is, of course, to stop causing the wrist pain. Maybe someone is sleeping on the wrist or bending the wrist at night. Maybe they need a simple splint at work to support them, or adapt the work schedule or ergonomics in the workplace. In other words, don't continue to cause the injury. Identify the causes. Try to eliminate as many as possible. Secondarily, what treatment protocols can be used to get the patient better? Is it hot and cold compress? Is it self-massage? Maybe physical therapy. There might be liniments. Then we get a little deeper and we get into the acupuncture. And that can be a very powerful tool to enhance wrist injury recovery. To learn more, visit healthcmi.com. Thank you for listening. Please remember to like and subscribe wherever you see our podcast. Thank you so much. Till next time, I'm Adam White, licensed acupuncturist, www.healthcmi.com.